army on the battlefield wouldn't be very effective if it were not organized or well-trained and didn't have leaders that had a strategy and understood the objectives. Very much like the leaders of an army, the New Jersey Association of Mental Health and Addiction Agencies, better known as Njamhaa, provides an army of behavioral health care providers in New Jersey with leadership that allows them to be more effective helping people in need. With their input, coordination, and advocacy, Njamhaa unites caregiving agencies and speaks for them statewide and nationally with one voice. Njamhaa is that group of strategists who have the ability to see the road ahead, translating private troubles into public issues. Njamhaa helps guide behavioral health care providers and their agencies towards success through advocacy and real-time communication, always with the goal of securing funding and regulatory flexibility. As with all endeavors, you cannot get everything you want, but if you are organized and work together, you can get a lot. Njamhaa has been the on-the-ground group that has, through advocacy, protected and promoted the needs of behavioral healthcare providers and their clients for 70 years.
I think the relentless and intense leadership that you provide, Debbie, I mean that sincerely. I think you have provided, you as the executive director, and I hired that. I was part of the committee to hire Debbie, and you certainly have not disappointed, and you provide an intensity of purpose that I think has distinguished Njamhaa, not only in the state, but on a federal level. So I really credit you for that.
When I watch various hearings, or when I see a clip on the news, for example, the governor's budget address, you're always there. There's no arrow that points and says, here's Debbie from Njamhaa. You're there, which is beautiful because you have the connection. What I love is, I guarantee you by the time I get into my office the next morning, there'll be a newswire or a bullet or an email from Njamhaa interpreting what happened yesterday and what it means to us today. So I don't have a shining moment. I have shining examples of when Njamhaa has provided the information that has allowed us, both the rescue mission and the industry, to know what's coming.
It is an honor to introduce DEBRA L. WENTZ, Ph.D., Njamhaa's President and Chief Executive Officer. Deb has provided leadership for 26 years, bringing Njamhaa into the future. As its first internal advocate, she has been instrumental in increasing Njamhaa's visibility with government leaders, expanding its partnerships, and enabling Njamhaa to speak with a unified voice for its members, while keeping in mind the end beneficiaries of services and supports.
The founding of Njamhaa as the New Jersey Association of Mental Hygiene Clinics in 1951 coincided with several key breakthroughs that positively changed the trajectory of life for those individuals living with mental illness and substance use disorders. The introduction of psychotropic medications and the first antipsychotic, Thorazine, the beginning of Narcotics Anonymous, and the publication of the inaugural edition of the Diagnostic and Statistical Manual in the 1950s gave rise to the start of deinstitutionalization of individuals with mental illness, and also hope for recovery for those with addictions, as finally these illnesses were recognized as the diseases that they are. And the passage of John F. Kennedy's historic Mental Retardation Facilities and Community Mental Health Centers Construction Act in 1963 opened the door to a new era where individuals with mental illness could move back to their communities. Over the next 7 decades leading to the present, Njamhaa convened its members, who together with a strong and unified voice called for the creation of an external environment that led to not only improved health for those with mental illness and substance use disorders, but also the possibility of leading lives with the same meaningful goals we all share, such as pursuing education and careers, living in safe and comfortable housing, and building meaningful relationships with family and friends. As the world evolved from Kaisers to Teslas, fountain pens to PCs, and rotary dial to iPhones, individual Njamhaa board members, providers, and later staff transitioned. But what remained constant has been the commitment to help children and families lead healthy lives. I am so grateful to all who contributed to the progress at each step of Njamhaa's history, and especially to those today. Njamhaa has proudly partnered with peers and families, the media, the public, state and federal policymakers and elected officials, and even governors to achieve goals on behalf of the more than 500,000 children and adults served by the community system. It's unusual when a former governor rolls up his sleeves to strategize with a trade association and its leadership in order to increase access to mental health care and substance use treatment services for many populations, especially one of the most stigmatized groups, the re-entry population, and helps them get the funding and resources they need. Governor McGreevey has done just that with Njamhaa, and we have been honored by these opportunities to work with him. He was always available to be a keynote presenter at conferences and collaborate on projects, and he constantly helps, both behind the scenes and out front, to get appropriate advocacy to advance initiatives. His leadership, dedication, and compassion are unequaled.
Deb, your leadership, your engagement with the state legislature, your understanding the importance of providing substantive information, the latest scientific research, best practices as to public policy dramatically shaped Njamhaa. What Njamhaa was, how the legislature understood it as a nonpartisan source of information, and how you changed the direction of Njamhaa to work with state legislative leaderships.
Never has there been a governor who has made mental health their #1 priority for the tenure of their governorship and put Njamhaa in the forefront, as Governor Cody did. He played a unique and admired role. Hitting the ground running from day one, Governor Cody created the task force on mental health and appointed Bob Davison, a Njamhaa board member at the time, to chair it. He also involved Njamhaa's leadership and members in serving on task force committees and making recommendations that changed history for those in need of mental health services in New Jersey. Importantly, Governor Cody funded these initiatives with more than $40 million and created a $200 million Special Needs Housing Trust Fund. These were unprecedented investments in services for individuals with mental illness and substance use disorders.
They're the go-to one. They're number 1, number 2, and number 3. You were an organization that we could always depend on and strong. You didn't have the fear of what some government officials might say.
As governor, Chris Christie made fighting addictions and the opioid crisis a priority that gave dignity and hope to so many who had been stigmatized and disenfranchised. It is a great legacy, and it shows that when something is personal, tragically, a friend of Governor Christie's passed away from an opioid overdose, it informs policy in a meaningful way. And to this day, He always uses his contacts nationwide to help advance substance use treatment and mental health care in New Jersey and across the nation, continuing to be a true partner with Njamhaa.
Njamhaa didn't care whether I was a Republican or a Democrat, didn't care whether I was perceived to be a conservative or a moderate or a liberal. What they cared about was, what was I willing to do on the issues of great importance to them? And then they stood with me if I was willing to do the right things. And so many organizations, unfortunately, become identified with one political party or the other, and that restricts their ability to be able to advocate effectively across all people to be able to achieve their goals. The great thing about Njamhaa was and is that they're not partisan, and that their passion is not for any political party or any particular office holder. Their passion is for the people that they serve.
Njamhaa has grown since it was established in 1951 as the New Jersey Association of Mental Hygiene Clinics, representing 70 member organizations. Njamhaa now represents more than 150 organizations throughout the state of New Jersey, including an additional 52 business partners in the technology, integrated healthcare, and life sciences and innovation councils.
Over a 10-year time period, the care management organizations had not received a rate increase of any type, even though there were new mandates about the kind of service that needed to be offered, and that the population was getting more and more difficult and expensive to, that had a need for more resources than we had. We had been advocating for a rate increase for a couple of years. Then Njamhaa got involved, and we were one of their top three priorities. And that was the year that we got a rate increase.
I've worked with Deb both on the state side as a state employee and also as a provider of services. And without a doubt, on both sides of the aisle, Deb has been a powerful partner for us at the state of New Jersey and for us as providers, really having a significant impact on our system of care.
NAMI New Jersey and Njamhaa have long worked together, and we've been coordinating our advocacy efforts to improve the lives of families and individuals across the state. And I have to say that Njamhaa understanding the role of a family member in a mental health recovery and understanding the need for family members to be a part of the conversation, not outside of the conversation, is something that's very important to NAMI New Jersey and to our members. And we are really grateful that Njamhaa understands that and is such a great advocate for families across the state.
Bill Sethi, former CEO of Preferred Behavioral Health Group and former chair of the board of directors for Njamhaa, points out the positive impact Deb WENTZ has had on the organization.
Deb is a person that she's, when you first talk to Deb or you first see Deb, you think, well, she's a very nice lady. Can she really handle the job? And that was some of what I heard when she first came on board as well. But she surprised lots of people. I mean, she just blew them out of the water, and she's kept on going. She is probably the most energetic, kind, bright. I can just keep giving you adjectives, but at the end of the day, she has, as I said, she's done a grand job.
Susan Lowry, MBA, Associate Executive Director of Catholic Charities Diocese of Trenton, and Njamhaa's current board chair, recalls first learning about Njamhaa in 2000. The Division of Mental Health and Addiction Services implemented a process for agency licensing inspection.
Njamhaa was right at the table with the state on what was happening and what the impact to providers would be, and was instrumental in ensuring that providers were represented in the licensing process, were informed about the changes that would be coming, and then the impact in terms of resource and infrastructure to the providers, and really advocating for the need for infrastructure to support the providers as they went through that change in the system.
Among other services provided to member organizations, Njamhaa has become the official trade association for addiction treatment providers, as well as mental health care providers. Bob Davison, CEO of the Mental Health Association in Essex and Morris County, and no stranger to mental health care and drug challenges in New Jersey, talks about the importance of Njamhaa's role as the representative for addiction treatment and healthcare providers.
Where I think Njamhaa has been particularly successful is in raising awareness in regards to mental illnesses and addictions, and helping people to understand that mental illness and addictions impacts all of us, right? If you think about it, according to the National Institute for Mental Health, 1 in 5 of us on any given day are having some type of mental health or addiction difficulty. 1 in 5, that's every family, right? 1 in 25 of us, according to SAMHSA, have a severe and persistent mental illness, something like schizophrenia, bipolar disorder, major depression with psychotic features. 1 in 25, that's every extended family. So every family and every community has been impacted by mental illness and addictions. And I think Njamhaa has done a wonderful job, certainly since I've been involved and before that, in raising awareness in regards to that.
Agencies that are directly and indirectly supported by Njamhaa, such as the New Jersey Reentry Corporation, provide critical help to many New Jerseyans. Rashida Smith is one example of a life saved and a person who is gainfully employed and who is now taking care of her young daughter.
Like I said, I don't know where I would be if it wasn't for them, if it wasn't for them hearing me, feeling me, understanding what I was going through, and really, really wanted to help. I'm grateful for them. I will forever be grateful for them. And because of that, to this day, whenever they call on me to be a face for their company or to speak, I show up. And that's my way of saying thank you. And that's my way of giving back. And that's my way of helping in the fight to make sure that others behind me receive these same kind of services, and that hopefully, you know, through my story and my struggles and my success, you know, people will continue to fund these programs so that they can provide these services for individuals like me.
So in the last 25 years, I noticed that the system, the mental health system, has been much more focused on wellness and recovery of people. And I think that this is a large part to Njamhaa's efforts to educate and advocate and really provide providers, behavioral health providers, with the education and the tools, as well as even more recently focusing on advocacy efforts to try to create more newer, innovative programs that are really helping people with a recovery and wellness lens. And most really important, and I think has been exciting, is to be more focused on the inclusion of people in recovery and peer provider roles, as well as just keeping people in recovery, the people that we're serving, in mind.
In essence, what Njamhaa is doing is allowing agencies to come together and to carve out time to commit to a common vision. And what is essentially happening is, out of these many visions that agencies have and separate entities, one vision is coming. So out of many, one is evolving, and we, with these common goals, and with these common goals, we are committing to support one another and to support the services in the state of New Jersey.
Njamhaa has helped Attitudes in Reverse find new opportunities, whether that's finding grants and funding opportunities or reaching additional people through the media and recognition through other organizations like that. It's been very helpful for us to get out there and spread the word.
Njamhaa has increased our visibility among school professionals, allowing us to receive more invitations to educate students, and allowing us to help save lives.
For the 35 years that I have been very involved with Njamhaa, I have never been disappointed in their ability and willingness to partner with community behavioral health providers and advocate for the best outcome possible in terms of funding, legislative support, regulatory relief, etc. So they're great partners, they're readily accessible, and they've had great successes in helping the community system grow in New Jersey.
During its 70-year history, Njamhaa has been successful in fighting stigma and communicating the fact that just because you have a mental health challenge, there is no reason why you cannot be successful in life. An example of that success was the award-winning public service announcement about famous people in history who rose above their mental illness to contribute great things to society. Sharon Adi, former head of marketing and public policy at Njamhaa, speaks about this highly effective PSA.
And when I first started in that position, we had started a public service announcement campaign called Mugshot, which took famous people like Abraham Lincoln and Beethoven, created a mugshot photograph of them, and highlighted what their mental illness was. And it was to raise the national narrative about erasing the stigma and discrimination that was being realized against people with mental illness. The campaign was very powerful, it was very impactful. We used a local New Jersey agency who provided the creative services for us pro bono. And it got airing on television stations across obviously the region and newspapers throughout the region as well.
In addition to advocacy successes, another major achievement that stands out for many who have been involved with Njamhaa is the creation of the Information Technology Project. Jerome Johnson, former Njamhaa board member and former president and CEO of Family Services Association Atlantic County, part of Center for Family Services Atlantic County, reflects on the importance of this project.
Our organization, which provides direct service to people, one of the things that we were weak in, and quite honestly were in the Stone Age, was information technology. A lot of our staff did not know how to use computers. And the information technology component of Njamhaa, they had people who had knowledge and came in and helped us with hardware and software. And some of our staff didn't know the difference between the two. And they did a great job of education. It took time. It took a lot of time. It took a lot of hard work. But we could not have done it without Njamhaa and their support.
One of the amazing things about Njamhaa is that the organization has evolved over the years, from a reactive group responding to a crisis to a focus group that is proactive. John Monahan, founder of Greater Trenton Behavioral Health Care, now part of Oaks Integrated Care, and past president of Njamhaa, speaks about this very positive transition over the years.
And things are less effective from a provider perspective when we're in that reactive mode than when we're in the proactive mode. Another example of proactive activity on our part was the Governor's Task Force on Mental Health, where Njamhaa was one of the major participants. And we had Njamhaa members on every committee. And they did an excellent job of identifying how the mental health system needed to be reformed from a provider perspective.
Through the years, Njamhaa has been an important partner for governors, both Democratic and Republican, in the state of New Jersey. It is with this depth of experience around drug addiction and mental health care that Njamhaa is able to dialogue and advocate for increased funding for the needs of the many agencies it represents. Don Parker, president of Hackensack Meridian Carrier Clinic and Hackensack Meridian Behavioral Healthcare Transformation Services Integrative Medicine and past Njamhaa board chair, has been part of this important interaction with government.
I think the most successful one that I've been involved in of late has been getting rid of IMD, Institutes for Mental Disease, where hospitals don't qualify under IMD to take Medicaid patients and serve them in private hospitals. which leaves them the only choice of going to a state hospital. We were able to, with Governor Christie, to work on a change. Not only did we get a change, but Governor Christie launched a campaign across the entire United States based on what he did here in New Jersey to get rid of IMD. So we helped countless thousands of people get the right kind of care in the right hospital for them, and with reimbursement behind it. So it's had micro impact and it's had macro impact, all emanating from Njamhaa.
One thing is certain. For the next 70 years, Njamhaa will be there to advocate and fight for the recognition and funding that its members deserve for their profound dedication to helping people through hard times and good times, delivering the highest quality mental health care that the citizens of the great state of New Jersey deserve.
I want to talk to everybody out there who's listening to this video today. As the 55th governor of New Jersey and someone who cares deeply about the issues of mental health and addiction, I want you all to remember that the work that Njamhaa does each and every day, year after year, decade after decade, has saved lives and continues to save lives every day. During my 8 years as governor, they were an active partner with me. And that's why for the rest of my life, I'll be an active partner with them. So thank you to Njamhaa for the extraordinary work that you've done and that I know you'll continue to do on behalf of those who suffer from mental health and addiction issues and their families who are there to try to support them and help move them towards appropriate treatment and a great life.
Njamhaa has always had my back on any issue on mental health, whether the go-to agency in the state of New Jersey with that question, even before you go to me. Let's be honest now, politically, it's very, very correct to fight on behalf of people who have mental illness. Look at how many legislators want to put bills in nowadays. So when I started in the 80s, there was none. It didn't happen. People weren't fighting publicly for people with mental illness. Now they're fighting to fight. Get in the act and get involved, and that's great. That's a sea change.
I want to say thank you for your commitment to Njamhaa. I want to say thank you for your commitment to the people that we have the privilege of serving. I want to say thank you to Njamhaa for willing to shine bright in sometimes dark places. Not only dark places in the recesses of a person's mind, whether it's addiction and mental health, but frankly in terms of public policy, and asking the state of New Jersey to be even better, to articulate the possibilities of people living healthy, constructive lives, but providing the support on whether it's mental health care or addiction treatment. Njamhaa's taken on a lot of fights that haven't always been popular, but I would argue fights that have almost always been right. I want to say thank you in a special way to the board, to all those persons who have served on the board for these many past years, for the incredible Debbie WENTZ, for her staff, for her commitment, for her passion, for all of the members of Njamhaa, and for all of the unseen individuals whose lives have been touched by you, people who provide daily services. I just want to say thank you. Every day I have the privilege of working for individuals coming home from prison or county jail and addiction treatment. Many of them are lost. But for Njamhaa, our vendors, the people who serve our clients, they would not have had a second chance. But because of Njamhaa, you've brought healing to their lives. You've brought hope to a new direction. And in many cases, you've given meaning to what constitutes a second chance. So to Deb, to the board, to each of you, thank you.
And through all of the years I have been with Njamhaa, I would not have been able to accomplish everything that I did without the dedicated staff that worked tirelessly behind the scene as we advocated, debated, and pushed policy forward. It is because of their dedication to our cause that uniting our many member agencies into one powerful voice is possible.
got your back, New Jersey.
As Njamhaa CFO, I'm making sure every penny counts.
I am so proud of the hard work that New Jerseyans are doing.
We're building a better New Jersey.
I'm proud to support those who are building better lives for New Jersey residents.
Happy to be working for such a dynamic organization and serving all those that we do. We're here for you.
Thank you for everything you're doing.
We're here for you, New Jersey. Whenever you need us, just call, text, or email us.
NJ, we're here to help you.
It's a privilege to support you, New Jersey.
We got your back, New Jersey.
Over Njamhaa's 70 years, hundreds of thousands of lives have been improved and even saved because of your incredible efforts. In expressing sincere gratitude to all our members, leaders, and partners, past and present, I exhort you to always remember that the larger the number of us who speak with one voice, the greater our success will be. And what does success look like? It's when we see a child, a youth, an adult, or family who's living a healthy, meaningful life. Being part of Njamhaa and making that happen is a gift worth celebrating.